I would ask the Supreme Court justices to take notice of what DACA recipients and immigrant families are doing across America, especially during this pandemic, to keep our country moving. The whole reason that I pursued a career in medicine is because I think back to what it was like to grow up in America as an immigrant, as an undocumented immigrant, not having access to healthcare. For me, the DACA program has been a game changer in first opening the doors for me to be able to enter medical school.
Undocumented! Undocumented!
I remember being inside the hallways of the Supreme Court and hearing those outside chanting, undocumented, unafraid. We showed up and we reminded the Supreme Court justices that this is our lives that they are deciding about.
Fighting for justice!
Being there that day with the thousands of people that showed up on the steps, I was really reminded that it's not just us who's in the fight. We have been allowed certain opportunities through the DACA program, and for the government to suddenly decide to take that program away, it is also, as an extension, taking away those opportunities and those liberties. That is what we're arguing. I'm a part of a mixed status family, so some folks in my family are undocumented, have DACA status as well, so we are all oscillating between stress and anxiety and feeling okay at times based on all the political uncertainty that goes on. My family decided to move to America to really follow their American dream, the search for a better future. My parents really sacrificed a lot in terms of starting over. I really looked to education and school at that point as my own key and path to the American dream. When I graduated medical school, it wasn't just me. It was very much my family graduating medical school with me because they have been through the trenches with me. For me, healthcare is a human right, and for marginalized communities, including immigrant communities and undocumented immigrants, but also homeless folks and just working class communities, everybody deserves the right to have access to healthcare. It is because I have been marginalized and I know what it's like to not have access to care that I very much understand the barriers for immigrant communities. And that is what I use to guide my work and guide the work that needs to happen to improve the system.